their experiences with tobacco taxes and putting tobacco taxes in place in the local community. So we appreciate you all coming today to share that with our audience. I am going to ask a quick poll question to see whether you know about our tobacco taxes in Virginia, and what's allowed and what may not be allowed, and how many have them. So the poll question is, how many Virginia cities and counties currently have an additional tobacco tax over the state tax of 60 cents? No Virginia cities or counties have an additional tax. 10 Virginia cities and counties have an additional tax. 73 Virginia cities or counties have an additional tax, or of course, every Virginia has that. Let's see whether you get close to the answer there. Couple more seconds, put your answer in, and then we will find out. Okay, it was split. Okay, 73, but yes, whoever said 73, so there's 73, 50 cities or towns, and 23 counties that have an additional tobacco tax. And we would love to increase that number. And that's why we're really doing the webinar today, is to showcase some success stories and one community that's working on it now. And I'm sure they will talk about the processes and even the challenges that come with it. And if you're in a local community, I know you know this is not easy work, it's hard work, and definitely challenges to come. But so much good will come of that. You know, I think I do this webinar sometimes and never introduce the tobacco control team. So I will do that today. I'm Gina Roberts. I'm the Southwest Regional Coordinator, and we have Nicole Mahan, and she is the Eastern Regional Coordinator with us, and Tiffany Eustace from the Northwest region with us today. A couple of our regional coordinators are at a conference, so you will just see the three of us here today, but we do have regional coordinators that work throughout the state of Virginia. And if you're starting this process, or once you hear from Kathryn and Ruth and Megan, you want to do this in your local community, please reach out to a regional coordinator who would love to assist you with this. But I'm going to go ahead and get started and introduce our panel to you today so that they can share with you their information. We have Kathryn Goodman. She's the Director of Communications and Population Health for the Virginia Department of Health's Blue Ridge Health District. Kathryn started her BDH career in 2013 as a health educator working on tobacco cessation and prevention, improving pregnancy outcomes and immunizations. She formerly managed the Blue Ridge Health District's Tobacco-Free Community Coalition and was previously chair of the statewide Tobacco-Free Alliance of Virginia. Kathryn lives in Charlottesville, Virginia with her husband and 2 kids. And then we have Ruth Morrison. She serves as the policy director for Richmond and Henrico Health Districts. Ruth leads the agency's efforts to champion systems-level change to not only improve health outcomes, but support more just and thriving communities. Ruth is a graduate of Bowdoin, I might be saying that wrong, College, Green Corps, and UVA Sorensen Institute for Political Leadership. She has 2 young sons and lives in the city of Richmond. And then we have Megan Gordon, and Megan graduated from Bridgewater College with a Bachelor of Science degree in Health Science in 1999. She has worked as the Program Director for Page Alliance for Community Action for the past 9 years. She works with parents, youth, school, and community partners to improve the social, emotional health of the youth in Page County and works to keep them substance-free. She is a certified ACEs interface trainer, and Megan and her husband, Buck, live in Page County with their 3 children, Kate, Tristan, and Maddie. Welcome again. Thank you so much for coming to share your experiences with us. And with that, I'm going to turn it over to Kathryn.
Good morning, everyone. Thank you for having me here today. I'm going to go ahead and share my screen. Does this look all right? Okay, I got a thumbs up. Thank you.
Yeah.
Well, okay, perfect. Well, I will apologize in advance that conveniently I lost my voice just in the last couple days. So I appreciate your flexibility with me today. I'm really excited to be here to talk about tobacco and cigarette taxes. This is a really important topic and something that we've addressed throughout the Blue Ridge Health District for many different years now. Just as a refresher from what Gina shared, and thank you for that. My name is Kathryn and I work for the Blue Ridge Health District. I started here in 2013 as our tobacco health educator. So over the past 11 years, I've really seen our tobacco prevention and cessation efforts grow tremendously. And it's lovely to see so many familiar faces and names here today at the webinar that I haven't seen in many years from when I was involved with TFAT. So here, just to give a refresher, is the Blue Ridge Health District, for those who may not be as familiar. We are centrally located in Virginia and serve over 260,000 residents and have 6 local health department locations, including one that's a community health center in rural Albemarle. So this is a picture here so you can just see some of our localities. And based off of our cigarette tax, some of the work that I'll talk about in just a moment relates to some of these specific localities. So I want to start off with really emphasizing today that I'm here to talk from the health department perspective. And one thing that is key for health departments is having local coalitions and community partners that can help with all the different offers and things that the health department can't necessarily do, which includes things like lobbying and advocating for certain things. So in the early, I was say the early 2010s, which sounds like a long time ago, the Tobacco Free Community Coalition was formed in the Blue Ridge Health District. And this coalition formed in response to our community health assessment that found that our adult smoking rates were significantly higher than the Healthy People 2020 goals at the time. It's exciting to say that, Tiffany is our regional tobacco control coordinator, and she has shared data with me recently that our smoking rates have decreased in the district. So we're making good progress, but we know there's more to come and more work that can be done with cigarette taxes. This coalition includes partners from the hospital systems, and nonprofits and other sectors in the local community that have been actively involved for many years to do work around cigarette tax, to free cessation classes, to Great American Smokeout events, and prevention work in the high schools as well. So there's a lot happening. It's been a little dormant at times when there haven't been any particular projects, but it's a good group that we can reconvene for the times that we need, like most recently with updating our youth vaping education or working on the cigarette tax. And I've listed here the current chairs if anyone is interested in learning more about it. And just a specific mention to the UVA Cancer Center, who has been a really wonderful partner for this coalition for the past 10 years. And Lindsay, who I'll mention in a few moments, has worked hard on all this work as well. All right. So like I said, I'm going to talk really from the health department perspective and give a very brief overview on this, as it's something that we could talk about for a long time. But in 2021, 2022, the Blue Ridge Health District partnered with the Tobacco Free Community Coalition and largely the UVA Cancer Center to address the latest General Assembly tax allowance. So the General Assembly gave the counties the ability to increase their local cigarette tax. As we just talked about, there's already a large number of counties across the state that have added the additional 40 cents. In our local health district, there are 6 localities and 4 of them opted to increase their cigarette tax. And within this 2021 timeframe, with that, there was the stipulation that they had to participate in the regional tax commission and the regional cigarette tax board. And that is where the Blue Ridge Health District got involved. So first, our phase 1 in 2021 is that we identified the needs and we did the research and worked with UVA Cancer Center, and they had a really wonderful volunteer or student intern who worked hard to do some literature reviews and compile all the resources that we would need to go address the cigarette tax board about the tax increase. Our former health director at the time then sent an email to the tax board and said, hey, we're interested in talking to you about the benefits of cigarette tax and where that money can go towards the community for helping with prevention work. So then we enter into phase 2. And this is where we determined that the next step for us would be to actually present and meet with the cigarette tax board to see what their decisions were, how they would be allocating the funds, and to work with them. I didn't mean to pass too quickly over the cigarette tax board, but there's a lot that goes into that. So I'm happy to talk more offline about it or provide resources as well. We presented in 2022, on how nicotine impacts some of our lowest income neighborhoods throughout the Charlottesville area and the Blue Ridge Health District, and then how more money is really needed to be put towards cessation efforts. And so it wasn't lobbying necessarily from the health department perspective, but it was just more education about, hey, if you're the county administrator and you all decide that you are going to increase cigarette tax, maybe you could put this money towards the health department or towards a local nonprofit to support prevention work and nicotine cessation. With that, then we engaged American Cancer Society Cancer Action Network, ACS CAN, it's a mouthful. We engaged these student volunteers from UVA who were so wonderful and excited to be able to go out, and they could then advocate on behalf of the health department, where that's where I was talking earlier, there's limitations for the health department on what we can do, but the volunteers were able to do this. We provided them with pre-training on how to talk to elected officials, have all the information they needed to know about nicotine and cigarette tax, et cetera. In phase 3, these students then went out and presented to the different board of supervisors. They talked about, and I will share just a couple examples here. Here's a screenshot of one of their presentations where they shared really powerful data showing that 70% of users, of nicotine users, want to quit, and then looking at how only 8% are actually successful in that. And that within that 8%, how did they quit? And looking at all those different resources that they probably had to have to successfully quit and stay quit, and talking about how if we could put the money from the tax revenue into the cessation efforts, it would be really helpful for our district. Here's just another example to show the information they shared in these presentations, and really highlighting down here on the bottom the current funding. And so emphasizing that while the Blue Ridge Health District has a regional tobacco control coordinator, Tiffany, she also covers 18 localities. It's a lot of districts to cover and a lot of places to help everybody with their tobacco and nicotine addictions and trying to help with the cessation and prevention efforts. So really emphasizing that there is no specific funding, for example, to this specific Fluvanna County, and that they could then find that funding to help their community members. Phase 4 was then after the students presented to the Board of Supervisors, was where Blue Ridge Health District would then connect on our annual budgets every fall, where we work with the district administrators and city managers on talking about our budget requests. I will be very upfront in saying, unfortunately, Blue Ridge Health District has not received any of the revenue from the cigarette tax yet, but we hope to eventually, so that we can put it towards folks that are already working on prevention work in the community, some who are volunteering their time. I know this was a quick presentation, but I know we've got some other great folks to present today. So I will just wrap up in saying, here are a few key takeaways. Cigarette tax is very confusing. It is confusing and it's complicated, and Tiffany has been a great resource for us, and Gina and folks from the state tobacco control program that are really there to help with this initiative. And we're happy to talk with other districts about this. We know nicotine and tobacco prevention work requires a lot of valuable partnerships. And so folks like our UVA Cancer Center and other folks in the community were really crucial for this work that's been done throughout the district so far. And then recognizing the power of local government and how, while many things have to go through the General Assembly, local government also has the ability to allocate some of the funding, and it could potentially go towards the health department or other agencies to work on tobacco control. And I know that was very fast and a lot of information, so I will wrap up here with saying that I'm happy to chat more if you have other questions. And then here's a QR code that you can scan to check out the Blue Ridge Health District, our tobacco and nicotine website, so that you can see all the information on what we're offering now, including our latest youth tobacco, our youth vaping toolkit, and other resources. Thank you. And I'm going to stop sharing and pass to Ruth.
Hi, everybody. Just getting all the technology to click together. I think my screen should be shared and my video should be on. So give a holler if anything's not working, but I will.
Yes, good. Thank you.
Awesome. Well, thanks to Kathryn for kicking us off, and to the tobacco control team for hosting this. I'm Ruth Morrison. I'm the policy director for the Richmond and Henrico Health Districts. We cover Richmond and Henrico here for the Virginia Department of Health, capital city, and our large suburban county just outside. There are a few points I'll make in this presentation that'll echo some of what Kathryn went over, but I'll try to take care to cover some additional ground. So focused on local cigarette taxes, this little presentation will run through what happened in 2019, primarily in the city of Richmond, and a little bit about what we've done since then, but focus really on the effort in 2019 to establish the city's first ever excise tax on cigarettes. So this is a map of crude prevalence for tobacco use for smoking in that year of 2019. So I'm not sure if you can see my cursor, but the city of Richmond is mostly at the heart of this map. We are looking at census tracts across central Virginia, so it does include census tracts out into Chesterfield, Henrico, and a little bit beyond. But the city of Richmond is really at the heart here. And of course, what you'll notice is the darkest red, and therefore the highest crude prevalence of smoking is not only here in the city, but is concentrated in particular parts of the city. And this was really top of mind when the mayor proposed in 2019 for the city's fiscal year 20 budget to establish a first ever tax on cigarettes. Is where would the effect of that tax potentially be felt? So the first thing I think to bear in mind here in our conversation and our experience in Richmond from 2019 and forward into the present is that, of course, we know that any proposed tax may have a disparate impact in terms of not all residents will pay this tax, right? As you can see, the burden of smoking is felt here, but so too potentially would be the benefits. And that's really where the heart of Richmond's story in 2019 through present takes effect. So some of this Kathryn spoke about, but we know there's a handful of things we need to do to address smoking prevalence and all of the health impacts that flow down from tobacco use. And one of the things that we can do is increase the price of tobacco. It is a evidence-based, demonstrated, data-driven strategy that when we increase the price of tobacco, rates of smoking go down. However, that is not something we should do in isolation. And it's not all price increases are created equal in the sense of the higher the price increase, the greater the sensitivity in the smoking population, the more impact it has on smoking population's behavior. So one of the things that we tried to do in 2019, again, this was a proposal of our city administration from the mayor's office, is as our city council was debating if they would accept and adopt this proposed first-time tax, is how could we actually combine some of these strategies and these foundational approaches. So starting with this tobacco price increase proposal, part of what we tried to look at is how can we incorporate some of these other strategies at the same time. And in particular, what our council together with our health department proposed is over here on the right-hand side, really trying to improve access to cessation services with the creation of a local cigarette tax. The context for us in 2019, and some of this is still true to this day, is that we are a Dillon rule state. So we at our localities in Virginia can only do things that our General Assembly expressly gives us the permission, the authority to do. And typically in the General Assembly, there are distinctions made between counties and independent cities. So in 2019, the circumstances were that Richmond alone in Central Virginia was given the permission to create a local cigarette tax if it so chose, whereas our outlying counties, including Henrico, which we cover, as well as Chesterfield, Hanover, and others, did not have that authority. We'll cover later, some of that has changed, and now all localities do have the permission to establish a local cigarette tax. But this was like a really live issue when the proposal for a local tax was proposed, because our surrounding counties could not participate with us. Some exceptions existed where down in Hampton Roads, all of the contiguous localities in Hampton Roads were given that permission several years before. In Northern Virginia, the same. But in Central Virginia, it was only Richmond. And that was a really live issue because there were concerns and questions about if Richmond established a tax, would residents simply, quote unquote, cross the border to buy cigarettes at a lower tax rate or a lower price point in the counties. And so that's something we had to address in terms of, as Kathryn said, like, what did we understand in the evidence base, not necessarily advocating for or against, and not necessarily prognosticating what consumers would do, but really just speaking to what we would understand the benefits or downsides could be in either case. But we worked with all of our nonprofit partners, the Cancer Society, the Lung Association, the American Heart Association, our regional tobacco control specialist was really front and center in helping convene and coordinate those folks. And then worked with our leadership in city council to like understand their concerns and fuse all of that together as the health department to try to present what we would understand a feasible path forward could be. So some of what we did in 2019, you'll see here, is we produced sort of white papers and more internal analysis that we shared with staff and city administration and the mayor's office, and slightly more broken down public versions of that for our city council members and their staff. We did absolutely attend these city council meetings where some of our tobacco industry representatives showed out in force there in red, opposed to the proposal of a local cigarette tax. And it's sensitive in local government. You can't always, depending on if you're a community service board or you're a health system or you're a health department like Kathryn and I represent, you can't always, bring the same lobbying type energy that the industry representatives do or activities. But we absolutely can and should, and it is our responsibility to still represent the evidence base. One of the things our government affairs office here at VDH often says when it comes to the General Assembly is when it is a VDH bill and legislation that we are taking up, we are the only organization that can, be the best advocates for that legislation. So in this case, while it was the mayor's proposal, we, working with the mayor's office and the council, really tried to make sure that the evidence base was not misunderstood, contorted, and left behind in this discussion. So essentially what got decided in Richmond is that not only would a first ever cigarette tax be established, but that we would use a portion of the revenues to support tobacco control and disease interventions. So trying to layer these strategies that we know from the evidence-based work, raising the price point and providing support to those residents who we know want to quit. So we used a portion of these revenues to establish the Free From Tobacco program, so that those residents who want to quit would have more gap filling services not already available from places like the Quit Line and others, to be successful in their quit attempts. So that's what was passed in early 2020. Folks will remember what happened later in 2020, of course, was a big interrupting event of a first ever COVID-19 pandemic. So that didn't stop the programming from moving forward, but it obviously did sort of change the timeline. So that program is in existence today. We see about $300,000 a year from the city's tobacco tax coming to support that program. And the last thing I think I'll end on is just that I think it's important to bear in mind that as a deal and rule state in the Commonwealth of Virginia, there really are precious few ways that the General Assembly gives localities to raise revenues. And what's sensitive here from a public health perspective is while it is, of course, the locality's prerogative if they want to use a tobacco tax as a new or enhanced form of local revenue generation, simply using a tobacco tax to raise revenues may not have enough benefit for those residents who suffer the impacts to their health from tobacco if that's the strategy that is employed alone. So we're really pleased that the kind of compromise that was reached in Richmond was that we would not only use the revenues to support general services in the city, but that we would use them to support tobacco cessation. So I think that's enough for now. I'll stay on for Q&A. And with that, I will hand it off to Megan.
All right, I am going to share my presentation. Possibly. There we go. All right, hopefully everybody can see that and hear me okay. Thank you all. I am very grateful to be here. And thank you, Kathryn and the Blue Ridge Health District and Tiffany for all of your help with everything that you have done for PACA. we're coming at it from a little bit of a different lens, as we are still in the process of trying to get our tobacco taxes increased, as well as get that allocated for a coalition. We are a nonprofit substance misuse prevention coalition that has been operating in Page County since 2006. And we have received drug-free communities grant funding, so that's federal funding. We received that in 2015. We are at the tail end of our 10 years of that funding, and we've honestly been working on sustainability since the beginning. As we went to some different conferences and talked to some people, we thought that, you know, working on advocating, because we can't lobby, you know, some of us are federally funded, some of our employees. So we worked on advocating for increases in tobacco tax, and then having that allocated to not only PACA, but other local nonprofits or agencies that are working on reducing substance misuse, especially around tobacco use. We realized that our communities were not, we have 3 towns, Shenandoah, Stanley, and Luray, and then the county of Page, and then their tax rates that they have implemented are all different and much lower than our surrounding areas. So I think 2 of our towns are at 20 cents per pack of cigarettes, and our county is at 20 cents, while one of our towns is at 15 cents. We've worked in the last 10 years to really build relationships with our community and our partners, and we felt like that continuing to educate and advocate for decreasing tobacco use would be a way for us to really work on asking them to increase the tax, even if it was only 5 cents a pack, so we can continue not only our prevention activities, but also work on cessation activities. Because we know ultimately that decreasing our adult use is going to help decrease our youth use. So the presentation I'm sharing is the presentation that our youth and some of our board members who are not funded, who are volunteer board members, took to our each board and each town board and our county board to present, you know, what is PACA, what we do, all of our different initiatives that many of them are very heavily involved in, and then a lot of our notable accomplishments and statistics just around everything, not just around tobacco specifically. And then, you know, the impact that we make on the community. And then we did borrow some from the Blue Ridge Area Health District from their presentation, as we met with them and Tiffany a few times, around the impacts of substance misuse. We really focused on, our youth focused a lot on vaping, because that's what they're seeing in the school system. And then we tried to do a little regional overview around what we see in our community, just because we wanted to take the time to educate our legislators around the impacts of substance misuse, and specifically smoking and vaping. And then we did talk to them a little bit about quitting, and then what we know about tobacco control, and then what our goals were really with the funding that we were going to use, and then how they can better get involved and better help us. So we took this presentation around, I think they started last spring and went through the summer. And then we also presented this to our coalition board members. After we did that, we have a group of volunteers who we're now working on a presentation specific to asking for increasing the tobacco tax. We were hoping to get these presentations out this spring and summer. It may be closer to the fall when they're going to be trained and ready to go out. They're also right now on the back end talking to some of because we've got some representatives in each town. So they're working on talking to their governing bodies, the people on their boards, and we hope to do those presentations in the fall to be ready to ask. Some of our volunteers are going to be asking and working on hopefully getting the tobacco tax increase in next year's budget cycle. So in the meantime, we are still continuing to do all of our activities that we do with our youth in the community as it relates to tobacco control. We work real close with our sheriff's office to do compliance checks. Our kids are constantly out doing environmental scans. They're creating PSA messaging. We're working with our local school system to provide education classes to our parents and our youth. We have vape detectors in our schools. We are continuing all of our education campaigns, in addition to really starting to speak to our legislators about how the increase could help to continue to sustain our efforts. So I know that was pretty quick. We don't have, fingers crossed that doing all of this is going to help to lead to some sustainable funding in the future. We also know that resources are limited, and as the towns consider different avenues to generate revenue, and our county considers that, what we're trying to focus on is that increasing price does help to decrease use. But you need to do everything else along with it. And we're really trying to make sure they understand that the need for prevention, that it's important, and that hopefully some of the funding can be allocated to prevention efforts. So I will turn it over to Nicole because I think she's up for questions. Thank you all.
Yeah, thank you so much to Kathryn, Ruth, and Megan. We really appreciate all of your presentations. I saw a lot of consistencies, whether it's, educating and partnering. I think that was the biggest things I really took away from all three of you, is really getting those partnerships, those collaborations, making sure you educate your legislators. Local government really has, a big impact, and really, letting them know, the reason behind this, not just, in general funding, but also tobacco cessation and prevention with adult use, which leads to that reduction in youth use, which Megan just talked about. So we saw a lot of the great things that's happened. For each of you, if you could talk about maybe your biggest challenge, whether it's getting into the door of legislators, whether it's educating them in an effective way or whatnot. And I know, Ruth, you have a meeting. So if you could go first to answer that question, I'll go with you first. Sorry to put you on the spot. But yeah, what was your biggest challenge that you've seen through the process?
Yeah, I would actually say the biggest challenge was trying to bring together the very legitimate and differing sort of concerns and priorities of the stakeholders here. And I think ultimately the way that we tried to do that is by ensuring that a portion of the proposed revenues, and ultimately the realized revenues, would go to cessation programming. And the reason why is because there were reasonable questions raised in 2019 about if the burden of the tax would fall disproportionately on lower income populations that we know smoke at higher rates. And so to us, it shouldn't have been sort of a binary question. Should we absolutely not have a tax and, let smoking continue at its given rate with its ongoing health burdens, and not enhance programming for those who want to quit? Or should we absolutely have a tax and not necessarily be able to support those individuals appropriately? And I think ultimately the compromise we reached was an attempt at that. But I do think that it's open for both evaluation of the effectiveness of the program that we have, as well as like ongoing discussion amongst those stakeholders of if that is the right balance for any other community to take. So while in Richmond, I think that was ultimately an important path forward for establishing our first ever tax, and a tax that wouldn't just go to general revenues, but that would support relevant programming for those individuals who would be paying the tax. I think in any other community that conversation may need to come together differently. In Richmond, we really had to put it together in the heat of a very consolidated budget season. And my recommendation to other localities would be to start that conversation now. If your city government, county government wants to consider a first ever tobacco tax or raising its tobacco tax to the acceptable state established or state authorized level, like talk with stakeholders about whether it's healthcare providers, your nonprofits and community organizations, and those residents who are going to pay the tax about what it would look like to have that be an enhancement for everyone. I think that that was the challenge for us, and one that I feel like we navigated reasonably well. But I think there's room for legitimate critique and looking in the rearview mirror, thinking about what we could have done better.
Great. Thank you so much for that, Ruth. That really opens it up to the process. That's something, we're always thinking about where to start, but it's great you talked about looking back, what you could have done better. I think that's something people who are going to start it can also, value and learn from as well. Kathryn, if you want to go next, and then Megan will have you.
I would echo a lot of what Ruth just shared. I think the other piece that we found challenging, I think it's two-part, like we live in a tobacco state, so we, have to kind of walk around those parameters and recognizing that some people in our district have tobacco farms. And I know that's the case throughout the state. So it's kind of a fine line there, as most of you know, working in tobacco nicotine control. The other piece that was challenging for us was actually getting the revenue back to the health department. And that was mostly because, one, it was peak COVID, so things were really crazy and it just wasn't all in the budget and our priorities to get the money back to the health department. And by the time we really got our foot in the door, some of the localities had already allocated the funds to other organizations. So now we're kind of in a weird spot of, okay, well, if we ask for this revenue, are we going to be taking it away from someone else doing another really important program? But then we have to bring ourselves back to recognize that, like, we need to be putting it back to the cessation efforts and supporting the community members who are greatly impacted by this particular tax.
I would agree with all of that. I think too, it's been challenging for us to kind of balance being in an area where we're in an area where smoking cigarettes it's very prevalent. Plus, we did have one town that did increase the tobacco tax when they were able to by 5 cents a pack, and they put that into general revenue. So really trying to change that mindset that we want that funding needs to go to help cessation and prevention efforts. That's been one of our biggest challenges, because as you start to talk about in a community where we live, where resources are limited, increasing revenue, the legislative bodies, they take it directly to general funds. So we're trying to really balance that on the back end and giving ourselves time to provide the education and lay the groundwork and the framework. So then when it does go through, it's going to be allocated where we ultimately want it allocated, which would be to sustain, whether it's through us or other nonprofits, to sustain prevention efforts within the community.
I was on mute. Thank you all for that. That's really, I'm still like processing what you said. So sorry, I can't react to it too much, but you all really talked about, making sure these funds go to, the efforts that we wanted to go to, the cessation, the prevention. And I think a lot of that goes into making sure you are educating your stakeholders, kind of what Ruth talked about, right? Like, what are the different interests, make sure they align. And my question real quick is what was the best way you found to educate these stakeholders? I know Ruth talked about, I think you had fact sheets on your flyer, you went to the different meetings. Any advice on that, whether it's, because sometimes they have such a limited time. I know with COVID, they've had virtual like meetings you can sign up for, but sometimes they're in those kind of meeting, you only have 15 minutes sometimes, but it's like back to back to back. So do you have any advice on that, whether it's something to make it stand out, the fact sheets that you've created, any I guess advice on how really to get your message out there?
I guess what I would say briefly is I think it's being at the table early and often. So again, whether you're the community service board, you're with the health system, you're with the health department, or you represent another stakeholder, there are coalitions and teams of people that are thinking about how to address and improve health outcomes related to tobacco, all kinds of tobacco use, not just cigarettes. And I think having your voice and your organization there early is absolutely one of the best ways to engage with stakeholders, because whether it's with a fact sheet versus a presentation, a Q&A session versus anything else, the only way you're going to know what's going to be effective and how to do that in a timely way is to be present in those spaces, and as well to really understand and kind of match make what are the challenges or the needs of any set of stakeholders that you can sort of bring to the table to address and respond and provide. So that may sound obvious, and I know with a lot of competing priorities and projects, it might not be easy to do, but I think dipping in and making sure that your entity, your organization is present at these spaces is going to be the best way to get ahead of the conversation if your localities might want to consider, or you want to encourage them to consider, a local excise tax on cigarettes.
I think too, I would add to that knowing who people can connect to. So we really made an effort in our group that is together now to go to our boards to make sure that there were people that are connected to somebody on each board in our community, so they can go and talk to them. They have more of a personal connection and a personal relationship, and really tailor what they're talking about to that specific stakeholder.
I would just echo all of that. I think the only other piece is to think about the different voices throughout your community that you can leverage, and really, having the community members who are most impacted being a part of the decision making and a part of the advocacy and sharing their lived experiences.
Can I jump in real quick? I know, Nicole, you may have other questions, but one question I had, and Kathryn, you didn't want to go into detail because it's a detailed process, but can you briefly describe what the role of that cigarette board is on this process? And then you go to council. So does the cigarette board have to approve your ask as well?
Okay, so I will be very clear. I'm not an expert on this, but from what I understand is when the General Assembly allowed, or they approved the bill for localities to increase their cigarette tax by the 40 cents on top of the additional of what we already had. In order to do so, the stipulation is that localities had to join a regional cigarette tax board. And there are 4 regional cigarette tax boards in Virginia, including the Blue Ridge Regional Cigarette Tax Board, which is who our district falls into. And that tax board then determines how the cigarette tax revenue comes in, and it's dispersed through each of the board localities. Does that make sense? So then it's instead of cigarette tax sometimes goes to the state level, but what's happening is that this cigarette board, then they're distributing those cigarette tax funds directly to that locality so they can distribute as they see fit.
Thank you, Kathryn. Yes, that makes sense.
Okay,
yes.
Ruth, or Megan, did I make that clear, or is that confusing? It's complicated.
That helps a lot. Thank you.
See if we have any other questions that I might have missed. Megan, Gary did ask about vape detectors. You mentioned them in your presentation. Do you want to explain what he said? He's never heard of them. Do you just want to really briefly go over what they are?
So I believe it was maybe coming right out of COVID or right before. I can't remember. It all kind of runs together. I think they were originally created to pick up kind of noise, but they realized they do pick up a change in the barometric pressure. So really the aerosols in the vapes is what they detect. We started putting them into our bathrooms in our high schools. So when people are in there vaping, they go off, the admin gets a detection, and they can go back, monitor the videos, or if there are adults out there, they know who's coming out of the bathrooms, and they can go ahead and check to see if vapes are present. They work relatively well. They are pretty expensive. I think the last ones we purchased were right around $1,000, and then there is an annual maintenance fee for them. With anything, the youth are already realizing how to get around the systems. So I think they're also making some modifications, but we've seen great success in our school as far as identifying those vaping in the bathrooms and then using them as a deterrent, especially when we first put them in. because the kids knew they were in there. We did see an initial decrease because of that, but then as they started to figure out, you know, how to either A, where they were, or B, get around them, we then saw our uptick again. I hope that helped.
I know Terry had a question real quick about products that only have nicotine like Zyn. So our message would still be the same. So nicotine is the addictive component in tobacco products, and we don't want anyone to be addicted to, a substance that, isn't gonna benefit them, in the long run. And if they start on Zyn, they could, start on another product like vaping, which can lead, to something else. So our message would still be similar to other products, like cigarettes, cigars, any other tobacco product would be the same message for nicotine-only products like Zyn. Of course, Terry. Let's see what other questions. Megan or Kathryn, do you have any last words? Or I know, Kathryn, you had like the three key takeaways, but if you guys want to add anything, feel free. I don't see any questions right now.
I would just say refer to your regional tobacco control coordinator. So you, Nicole, and Tiffany and Gina have been really helpful to our district, and we're so grateful to have Tiffany a part of our district's operations on a pretty almost daily basis. And so you guys are a great resource and can connect and provide more information for other locations throughout the state that want to take on this endeavor.
Yeah, I would echo that, and then reach out to anybody that has been doing it. The best thing I believe about the prevention field is nobody ever takes anything from anybody. We all borrow it because we all want to see the same thing. We want our areas, our communities to really all be healthy and substance free. And I think the more we can work together, the better it's going to be.
Great. Thank you guys for that. Yeah, I definitely, we're always big on partnerships. Like all of you talked about partnerships, collaborating, figure out who knows who. And a lot of it is just, the knowledge. Who knows the knowledge? Who's been through this? Who's had the experience? Who can help you, whether it's sharing the fact sheets, whether it's sharing, who you talk to that has really been helpful. But thank you both. And I know Ruth had to leave for another meeting, but this was really great. I'm going to have to rewatch through it another time to really have some good takeaways. So I don't see any more questions. I'm going to send this back to Gina to kind of close out everything.
Thank you, Kathryn and Megan, and definitely Ruth, for sharing your stories and how you kind of are working on this or have increased your taxes in your localities. I think, Kathryn, you said this, there's during your presentation, there are very few opportunities, right, through General Assembly and through legislation to really make an impact because of the Dillon rule. So this is one way that localities can do something to really put some of the funds towards cessation activities or really help impact the tobacco prevalence in your area. So thank you so much for sharing your success stories and your work. And Megan, we wish you luck as you venture into this year. So we are coming to a close. We're going to have a few minutes of your day left. So definitely, it's gorgeous outside. We had this scheduled till 11. So you have right now about 7 or 8 more minutes. Get outside, take a walk around, and just kind of have some exercise before your next meeting, which will probably come up again at 11. If you're like me and have back-to-back meetings. But I did want to invite you all to our next Tobacco Free Tuesday webinar, May 21st. And if you're interested in tobacco history, how this all started, and even tobacco policy in Virginia, please join us. Dave Ress is a reporter for the Richmond Times-Dispatch, and he's going to be joining us next month to really give us a really good overview of where we started and where we are now with tobacco. And so I'm very excited to have him join next month. So enjoy your day, enjoy your month, and I will see you again in May. Have a wonderful one. Bye, everyone.